This Pride Month, the University of Illinois Hospital and clinics have a lot to celebrate.
UI Health has been recognized as an LGBTQ plus healthcare equality leader for the 9th year in a row. That means they are going beyond the basics when it comes to adopting policies and practices in queer care. Dr. Mimi Arquilla and Carl Johnson join us now with more. Thank you so much for being here.
Thanks for having us.
Thank you.
Yeah, so doctor, tell us what this designation really means.
Yeah. Do you want to take that?
Okay, certainly. Okay. It means that our healthcare facility was evaluated in 4 areas, and those areas being the programs and services we provide for LGBTQ plus people, what our foundational practices are in terms of our organization, in terms of our involvement with the community, and also in terms of our employee benefits and services. And so we provide services in all 4 of those areas, and we do it, we feel very well.
Yeah.
And that is how we got that designation, is because we were able to achieve high standards in those areas.
And it's so important to promote inclusive care. What does that mean? Tell all of our viewers.
Yeah, so I think when understanding inclusive care, you first have to kind of understand that not everyone has the same experience in healthcare, and that can be for a lot of reasons. It can be because of gender, sexual orientation, race, insurance status, lots of different things.
Right.
And with inclusive care, the goal is to provide high quality care to everyone. And to do that, you really have to break down barriers and meet the community where it's at and really address those needs.
Talk about some of those hesitations that people might face in going to get care, where someone may not even think that this is something that other people are facing.
Yeah, so there's a lot of reasons people don't like going to the doctor.
Yeah.
I think in particular for LGBTQ people, it can be, fearful of other situations that have happened that have been unpleasant, like being called the wrong name, being misgendered, asked, invasive questions that don't really have to do with what you're there for, or just having a provider who doesn't know a whole lot about LGBTQ health. And as someone who's not only a doctor, but like a patient and has had all of those experiences at other healthcare institutions, I completely understand why people don't want to go to the doctor, and I really empathize with them. But I think it also kind of drives me to advocate for, a really great healthcare experience. And, similar to UI Health, the guiding force is kind of treat others the way you'd want to be treated. And in doing so, there's a lot of things to make people more comfortable at the doctor in the healthcare setting. And, some of those things are as easy as wearing like a pronoun, pin to let people know your pronouns, and, asking people their name, their pronouns, using those correctly, and just creating a welcoming environment.
Talk about some of the other inclusive care options that UI Health offers.
Mm-hmm.
Well, we recognize that there are barriers to care in healthcare, and one of the things that UI Health did was to create a designated position of LGBTQ plus patient navigator, and that is the role that I play in the institution, and is somewhat new and recent, maybe about 1 to 2 years old. And what I do is advocate on behalf of LGBTQ clients, and I'm there to answer questions and support them in the course of their healthcare journey with us. And we try to get the word out to as many people as possible in the organization, and to give them my name, give them my number, and I'm there to interpret and guide them through the system.
Now, would somebody contact you before a visit, Carl, or is that something that happens when you show up or afterwards? How does that work? Are you there with them?
It can happen either way. Someone might. And people find our website very easy to navigate.
Yeah.
And I've gotten a lot of phone calls and emails from people with questions about our services and how they would go about accessing care. Or the person is already a patient, and I get a referral from Dr. Arquilla, and we share a few patients in common. And can you help this individual with this particular issue or concern that they might have, or someone was maybe treated in a way that they felt uncomfortable about, and we intervene in those situations as well, because we want everyone to be treated well.
How does it personally make you feel that you keep hearing for so many years in a row that you are a healthcare equality leader? I mean, it has to be just to make you so proud to work
It
for UI
does,
Health.
yeah. And, like I mentioned, being part of the community and being at a place that represents the community and provides, really excellent care, really, keeps me there, and, I love working there.
Such a wonderful time.
Amazing.
We're only
Yep.
highlighting it, obviously, with Pride Month, but this is something you guys are doing throughout the year.
Yes.
Such
Yes,
wonderful, wonderful work.
Yes.
Dr. Aquila and Carl, thank you so much for being here. We really appreciate it. For more information on all of this care, you can head to uihealth.care. There's the website, there's the number. You can get it all there.